My name is Brandon Morris, and the following presentation is a case study between myself and my client. Firstly, my client completed multiple consultation forms, including an informed consent form through QUT. My client then further proceeded to complete 2 pre-exercise screening forms, as well as a multiple lifestyle assessment form. From there, my client and I were able to construct some notes from our consultation, outlining the client's goals, identifying some limitations that may be involved, as well as constructing his current fitness and lifestyle notes. From the data collected, I was able to construct a needs analysis and summarise an action plan, a training program, as well as outline any testings involved in order for my client to achieve his goals. The importance of our pre-exercise screening is vital for any practitioner and client, as it identifies any potential health risks before commencing an exercise program. It does also further reduce the emphasis for the need of more medical evaluation. The first pre-exercise tool used was the ESSA pre-exercise screening tool. My client, with a height of 184 centimetres, has a weight of 97 kilograms, is a 27-year-old male with a BMI score of 28.7. He then answered no to all stage 1 questions, has a normal blood pressure, cholesterol and blood sugar level, and has had no recent hospital visits or is not on any medication. My client then completed a PARQ and U questionnaire. He then answered no to all 7 questions involved, thus nullifying the risk of any cardiovascular disease. The reason for my client's appointment today is that he had a recent knee reconstruction in December of 2016. His main goal is wanting to attain his previous performance and physical capabilities pre-surgery. My client is very motivated in order to develop a program and obtain these results. His main goal is to regain a consistent squat routine through training again, as well as gain the confidence and strength to begin running, as well as performing multiple jump tests. He mentioned a previous 1RM squat of 130 kilograms. However, I had to explain to him that first of all we need to be able to perform the movement itself. My client is very active currently as he performs his own rehab program, as well as multiple resistance training sessions per week. He is a casual work employee and has to conduct 3 days per week of full-time study at university. Together, we were able to outline 3 main goal areas in which we wanted to see improvements. Firstly, improving the muscular mass and hypertrophy within the legs. Secondly, with a behavioural goal of improving the efficiency within the workouts, overall reducing the total workout time. And on a performance basis, we want to record a full 1RM squat, record a steady 1 kilometre pace to time trial, and conduct a... From the information collected, I was then able to perform a needs analysis test and furthermore subbing that into 3 separate categories. Firstly, is the client ready to commence post-surgery exercise? A full rehabilitation can take up to 12 months to achieve pre-injury abilities. My client and myself wish to advance this time frame. Studies have shown that low levels of shear force upon the knee do put the ACL under incredible strain. So we need to make sure that the rehab process is strong enough to be able to handle any strain through the quads. And finally, a hamstring graft reconstruction can drastically improve the post-rehabilitation flexibility. My client did have this procedure done with his reconstruction surgery. From there, my client can then proceed to squat. And isokinetic knee and hip extension strength exercises have a significant correlation to one's knee and hip extension strength. Furthermore, a rhythmic gait cycle creates a more efficient biomechanical movement for hip flexors, quadriceps and lower limb muscles, ultimately relieving stress upon the knee and the joint itself. If that proceeds to be successful, the client can then commence a running program, which the mean amount of time for a young athlete to recommence light track work is 54 days post-surgery. My client has surpassed that recommended time frame. My action plan and recommendations for this client is to undertake a resistance training program focusing on the quadricep and gluteal development through hypertrophy. Following the success of this program, we can slowly introduce a light running program. This program will be a non-linear periodized program which is used to proven to be more effective in increasing muscular strength and hypertrophy than other linear methods. Compound movements will be the base exercises of this program, which include our squat, our deadlift lunges, leg press movement, These larger exercises will furthermore be supplemented by a strong focus on plyometric movements in order to improve the acute effects on a 1 rep max squat improvements as well as jumping capabilities. The initial pre-testings to be performed will include a 1 RM squat, a vertical leap maximum, and a 1 kilometer time trial. In summary, the client is to complete this program over a 12-week period of no less than that time frame. Testings will be undertaken again after the 12 weeks, and of course, being a rehab client, pain management must be identified and treated throughout the program itself to ensure that we can achieve our weekly targets.